In this segment, Mr. Crutcher is joined by Life Dynamics Director of Research, Mona Pasignano. We now join Life Talk in progress.
You know, we say that abortion is the taking of a human life. In the public, of course, the abortion industry, oh, no, we don't kill human beings. These are little globs of tissues and cells and that sort of thing. But when you hear them talk in their private moments or at a convention or something, they make some very revealing statements, don't they?
These people know more than we do exactly what they're doing. Let's just start with some National Abortion Federation tapes. These are conference tapes that are taped every year, National Abortion Federation being one of the largest organizations for abortion providers in the United States. This one is from March 31st through April 2nd, 1996. It was held in San Francisco, California. Merle Offman just jumps in and just cuts right to the quick and says, look, we know what this is. We can use all the euphemisms that we want.
Right. We can sugarcoat it all we want to.
Exactly.
But everybody in this room knows what we're doing.
So I find a lot of euphemisms, T-O-P, V-I-P, and, you know, I have to try and cut into that language because, I mean, we are talking about an abortion here. And also that the staff is uncomfortable when a patient said, I think I'm killing my baby. So I'm comfortable with saying, yes, you are, and how do you feel about that? You know, oh, you are. You're killing life, you're killing potential life. I mean, my God, if you don't do that, in 9 months you do have a live baby.
That takes all the varnish off this deal.
Yes.
They're clearly admitting what they're doing.
And just to show that this goes further, let's just listen to another National Abortion Federation tape. This is from a Philadelphia, Pennsylvania conference. It is also their annual convention. It's well, actually, this is their risk management seminar. This is September 18th through 20th of '94. The person you're listening to is Clara Keys. She works at one of the clinics.
We were still using only the, quote, accepted words. We would never use the word baby. We were still just talking about the tissue. And in fact, when I trained the people who work for me, I trained them as I had been trained, which was that you don't use that word. Well, when you start paying attention to what your patients are saying, there's no way to deny that for them, the word baby is very real, and that is, in fact, how many of them are viewing the pregnancy that they are about to terminate.
Again, they're parsing these words. You know, these people obviously kind of dance around here. They're admitting that they're killing, but they don't want to do so in a way that makes them look guilty. I get the sense they're trying to have their cake and eat it too.
Let's just listen to one more tape. This is from that same conference. The person you're listening to is Charlotte Taft, and she is from Ruth Street Clinic in Dallas, and she's just going to tell you a little bit about how the pro-choice community even lies to itself.
There was an activist, the same woman that Janie Bush was talking about, who is a pro-choice activist in the Dallas community. When she came into our clinic, we were inviting her to learn more about abortion. This is a quote from this woman. She said, if I believed that abortion was the deliberate ending of a potential human life, I could not be pro-choice. I said, it would be best for you not to see a sonogram.
Now, they have to deceive their own people. And a good example, Mona, of this thing of deceiving or acclimating, if you will, even their own people, is this next clip we have where this is, well, tell us about this clip.
This is the National Abortion Federation again. It's a fall risk management seminar, September 12th through 14th of 1993, held in Seattle, Washington. The doctor that is talking is Dr. Thomas Easterling. He's talking about training residents.
To do abortions.
To do abortions,
and
that's right.
And the theory is you start them out doing 8-week abortions, then 10 weeks, then 12, and you kind of move them along until you're doing the later terms. Okay, now Mona, before we listen to this tape, let's define one of the terms that's used here. It's calvarium, and that just refers to the head of the baby. Instead of saying head, he says calvarium, but that's the term used in the medical community.
And so it's just like, well, if I'm going to teach them, we got to start at an 18-weeker, or some people start at 21 weeks. The first one is a 21-week pregnancy. It goes just fine. I was surprised. In fact, because I do mostly 18-week pregnancies, I now hate to do 15 and 16-week pregnancies. They're insubstantial, if you will. They break apart too easily. The residents lose calvariums very easily at 15 and 16 weeks, because when you bring the the legs are the thorax and the lower uterine segment, the calvarium doesn't necessarily follow. At 18 weeks, it always follows.
Okay, now, he's talking about one of the advantages of doing the late-term abortions is that the head of the baby doesn't pop off and stay in the woman.
Right. You can't start them there. You have to start a resident way up at about 18 weeks, because if you start them at like 14 weeks, the head pops off, and then you got to go fishing around.
Right.
And I mean, when you talk about someone's head popping off, you know what you're doing.
Exactly.
You know this is killing.
And all you've got to do is go to any book where you can see fetal development and look at a 14, 16, 18-week baby. This is very recognizable. You can show this to a 3-year-old and say, what is this? And they say, that's a baby. Right.